If you're stuck on size 1 or size 2 of the dilator, this video is for you. I'm going to show you why you're stuck, which tool you need instead, and what is the right sequence of using those tools. Hey, I'm Dr. Darshana. I'm a pelvic PT, and for the last 16 years in the clinic, I have helped countless women break through this exact plateau, and I'm going to show you that exact system in this video. Stay till the end because the biggest mistake I see is the wrong order of using those tools. So in the end, I'm going to not only show you the tools, but the sequence. And don't miss that because that's going to end up saving you a lot of time and heartache, okay? So let's get started. If you're somebody who has experienced painful sex, maybe you stumbled upon vaginal dilators as a tool for treating it, right? Dilators do a couple of things for us. Number one, they help you break through the fear of penetration. Number two, they are kind of gradually increasing in size, so that is graded exposure of a different size. That's why dilators come in size 1 through 8 sometimes, right? And then the third is, it is kind of retraining your nervous system and decreasing that guarding response, right? So dilators do three things. If you're somebody who has experienced pain, you might have noticed that you get scared and your body starts to anticipate and become tight before anything has ever gone inside. And that guarding reflex, dilators help you treat that fear. They don't really treat the issue. That's why size 1 dilator or size 2 dilator, where the biggest thing you're trying to fix is the fear of penetration, is the anticipatory muscle guarding, right? So size 1 and size 2 are very effective if you feel the biggest obstacle is the fear associated with penetration, right? And then a lot of my patients get stuck at size 2 because somewhere we thought that the whole plan is go from size 1 to 2 to 3 to 4 to 5 till the size of the partner, and from dilator to partner, and voila. Right? But for 16 years, I've seen that it doesn't necessarily work that way, and somewhere along the line we get stuck, and that's where we need a different tool, and that's your pelvic wand. So let's look at a demo for a second, right? This is the vulva and this is the vagina that goes inside. Dilators come in different sizes so we can gradually stretch this part, so we can gradually decrease the fear that's associated with it. However, the vagina lives inside the pelvis. So if you think about it, this is a human pelvis and it lives inside our body. So these are the two sides. Let me put my pelvis together here. This is a human pelvis. It lives inside the body, and the vagina is like a tube that comes inside it. So if I take it apart, you're gonna see how many muscles we have, and the vagina is like a tube somewhere here. Now, if you're stuck on size 1 or size 2 dilator, what might be happening that this tube, the vagina tube that's inside the body, muscles are tightly gripping around it. So in order for us to progress past size 2, somebody needs to massage and relax these muscles. And that's where we need something called a pelvic wand, okay? So the wand can go inside the vagina and reach the muscles to massage them, right? So think about it this way. We're going inside and massaging these muscles so the vagina can open, and now we can make progress. So let's recap. Dilators look like this, and we use them when the biggest piece is gradually increasing the size, working through desensitization, working through fear of penetration, and when you're trying to simulate penetrative intercourse. So dilators, if you just leave them inside, don't work. You have to work them as if you are simulating sex, right? Pelvic wand is so, think about it like a back scratcher for your vagina, right? Like you're going inside the vagina to reach deep pelvic muscles that might be tight. You massage them with this and then use the dilator to use the added space that you just got because of this tool, right? So the correct sequence here is use the dilators when you are stuck at a certain dilator or feel a certain tight spot. Then we bring out the wand, find that spot, massage it, and then go back to the dilator. Okay, so if you're wondering, do I need a dilator? Do I need a wand? How do I know? Ask yourself these questions. What is the biggest thing that's showing up for me right now? Is it fear of penetration or anticipation? If the answer is yes, we're still working with dilators. If the biggest thing that's showing up is not so much fear, but you get stuck at a certain point or a certain depth, the answer is wand. And here's the reality. It's never either or. You need both, right? So let's say you're stuck at size 3. The wand comes out, you work your magic, go to size 4, or use size 3 to simulate different movements to now use the space that you have gotten, right? Think about it this way. When you hit a plateau, you can't use the same tools that you have been using. We're gonna need a different tool or a different strategy. This is going to be your different tool. If this helped, in the next video, I'm gonna go over how to exactly pick which dilator size you need and the very detailed kind of techniques of what to do with the wand when you're inside versus just work with the wand. So don't forget to hit subscribe, and I'll see you at the next video.